What if your phone could predict a heart attack before you even felt a symptom? Or what if a doctor thousands of miles away could guide a life-saving surgery in your local town? This isn't some far-off sci-fi movie anymore. This is the future of healthcare that's being built right now. And the World Health Organization, well, they've created the global blueprint to get us there. So let's break down their massive plan.
Okay, but before we jump into the shiny tech and the big solutions, we have to understand the scale of the problem. And let me tell you, it is colossal. The WHO calls it the triple billion challenge. And honestly, it's a crisis on a scale that's kind of hard to wrap your head around.
So what on earth does a triple billion challenge actually mean? Well, picture this. It's about getting 1 billion more people access to universal health coverage, then protecting 1 billion more people from health emergencies, like the next pandemic. And on top of that, ensuring 1 billion more people enjoy better health and well-being. It's a goal so huge, it sounds almost impossible.
Right. So how do you even begin to tackle a problem that massive? The WHO's answer isn't just build more hospitals or train more doctors. It's about a total, fundamental reinvention of how we approach health itself. And the engine for that reinvention is digital health. Now, we're not just talking about putting patient files on a computer. No. We're talking about a complete system overhaul, supercharged by the technology that you and I are already using every single day. So, digital health, what is it really? It's kind of a big umbrella term. It covers everything from the smartwatch on your wrist that tracks your steps, all the way to a super smart AI in a lab that's diagnosing diseases. It's this whole ecosystem of tech, all pointed at one single mission: improving our health. And this is where it gets really exciting. Think about AI that can spot cancer on a scan with superhuman accuracy, or virtual care that connects a top specialist in, say, New York City with a patient in a tiny remote village. We're talking about smart wearables, big data, even blockchain. This is a powerful toolkit for the future of medicine. And this isn't just theory, it's already happening. Look at this example from the NIH. They describe a system that links a person's phone and wearable device directly to their doctor. This creates a constant, two-way conversation of health data. It's not just the doctor telling you what to do, it's your body telling the doctor what it needs in real time. So with all this incredible technology bubbling up, the big question is, how do we get everybody on the same page? How do we make sure it's used safely and effectively all over the world? That's where the WHO's global strategy comes in. You can think of it as the world's official playbook for digital health. And when you look at the plan, its core idea is actually pretty straightforward. It's a roadmap that shows us how to get from our big goals and objectives to a series of clear actions to the real-world impact we want to see, a healthier, safer world for all of us. The whole strategy is built on 4 main pillars. These are the big foundational ideas that everything else stands on. Let's dig into each one. First up, Pillar 1. It's all about working together. Global collaboration. Why is that so important? Well, if we've learned anything recently, it's that a health crisis in one corner of the world can become everyone's problem almost overnight. We're all connected, so we have to act like it. So what does that look like in practice? It means setting up global networks to spot and track diseases before they spread. It means countries sharing what works and what doesn't. And it means getting everyone from governments to tech giants pulling in the same direction. Next, Pillar 2. This is about recognizing that every country is different. A digital health solution that's perfect for Japan might be totally wrong for Nigeria. This pillar is all about helping each and every country build its own digital health plan that actually fits its own needs and resources. This is where things get really practical. We're talking about creating funding models that last, making sure different software systems can actually talk to each other, interoperability, and maybe most importantly, setting up rock-solid legal and ethical rules to keep our personal health data safe. Pillar 3 boils down to one crucial word: trust. I mean, think about it. If we're going to trust our health to technology, we have to be absolutely sure that it's safe, it's secure, and it's being used ethically. This pillar is about writing the official rulebook for digital health. And it's not just about tech, it's about people. This means training our doctors and nurses so they're comfortable with these new tools. It means creating global standards so data can be shared safely across borders. And it means making sure our leaders have the knowledge to make smart decisions about all this stuff. And that brings us to our final pillar, Pillar 4. And you could argue it's the most important one of all. Because, let's be honest, all the amazing tech, all the data, all the planning, it's all completely pointless if it doesn't actually help real people live better lives. So, how do we make sure of that? By putting people, not technology, at the center of everything. By teaching everyone how to use these new tools effectively. By using technology to close the health gap between rich and poor, not make it wider. It's about shifting from just reacting to sickness to proactively keeping people healthy. So, when you put all 4 of these pillars together, what do you get? You get more than just a strategy document. You get a vision. A vision for a future where high-quality healthcare isn't a luxury, but a reality for everyone, everywhere. And this quote from the WHO just sums it all up perfectly. The goal is to improve health for everyone, everywhere. It's such a simple phrase, but it's the powerful guiding mission behind this entire global effort. This is the big picture. This is the transformation. We're moving away from the old way, care that's reactive, systems that don't talk to each other, and a one-size-fits-all approach. And we're moving toward a future that's proactive, connected, personalized, and truly focused on people. So the blueprint is there. The technology is advancing every single day. The only real question left is, are we ready to build this new future together? The challenge is enormous, but the potential reward, a healthier, more equitable world for every single one of us, is just immeasurable.